Very good.
All right, where's my stethoscope? Hi there. This is Lisa Burton doing our assessment for Nursing 320, and I am with my patient, Barbara. Say hi, Barbara.
Hello.
And we haven't started our assessment, so our 30 seconds haven't started, Wendy. And we're hoping that you use some sense of humor in this because you're dealing with 2 emergency room nurses who don't have a lot of experience with this type of filming. Okay, so I'm going to walk in and I'm going to ask my patient if I can do an assessment. So Barbara, can I do an assessment on you today?
Absolutely.
Okay, and I've washed my hands and I've pulled the curtain and established a contract that it's okay to do an exam. So I'm going to inspect at first. We're going to do head, eyes, nose, ears, and throat exam, including the skin. So I'm going to stand in front of the patient, and the patient is seated with her legs dangling. Her skin color is basically pale, but normal for her because she's an Irish girl. And she's got normal intact skin. She's awake, alert, oriented, and cooperative. Her mood today is actually pleasant, which is shocking, but it is. I'm kidding. And she is able to move on her own. Her speech is clear. Her tongue is midline. She has no neurodeficits to impede the exam. And she has a normal set of vital signs, temp 98.6 that I took with a thermometer, a blood pressure of 118/68, and a heart rate of 68 and regular with no ectopy that I noted. I did a 1-minute inspection of, a 1-minute apical pulse, and it's normal, and I didn't hear any gallops. Then I'm going to move into the head and face, inspect and palpate the scalp, hair. So I'm looking at her scalp and her hair. She has no open areas on her skin. I'm going to palpate her scalp. I don't feel any abnormal bumps, lumps, or any scar tissue that I might elicit in her neck or in the back of her head. I'm going to ask the patient, Barbara, to wrinkle her forehead. And now I'm going to have her close her eyes against my resistance and try and open. Okay, there you go. And pop out your cheeks. Good, and that's symmetrical. Clench your teeth. Okay, and here's the thing with the chin. We're going to go ahead and inspect for symmetry, so your face is symmetrical. There's no facial droop that I see anywhere. Let's see, we're going to come down to palpate her sinuses. So I'm going to do maxillary, and I'm going to do frontal. So her maxillary sinus is here. And actually, it's not. Her frontal sinus is here. And I'm going to palpate her sinuses. And I don't feel any swelling or abnormality. Do you have any sinus problems?
No.
Okay. And we're going to move down to palpate her temporal artery on either side. And you can feel that. And I can actually feel it on both sides. I'm going to palpate TMJ as the patient opens and closes her mouth. She's going to move her jaw side to side. So I'm going to palpate her TMJ. Open. Oh, Bob, you're in a rush. Now go side to side, right and left, and that's normal and symmetrical. And I do hear a click on that left-hand side. And she's already told me that she has some TMJ issues from chewing gum and stress in the jaw. Oops, sorry. Wendy, again, we have a sense of humor, but we have to, right?
That's right.
Palpate the trachea for location of midline. So head up and take a look at her trachea from the center. I don't notice any trauma, any history of trauma?
No.
Okay, and I'm going to put my hands in, and it's not deviated to the left or the right. It's midline and center with no history of trauma and no issues. We're going to move down, and we're going to test the range of motion of the neck. So I'm going to have her put her head all the way back. Good. And then you come all the way forward and touch your chin to your chest. Come back to center and turn your head all the way to the right, nice and slow. And good, all the way to the left, nice and slow. Come back to center. Bring your right ear to your right shoulder, nice and slow. Come back to center. And bring your left ear to the left shoulder. And come back to center. Good job. You're going to test muscle resistance for the head forward and backward and the head turn, which we just did. You're going to go ahead and shrug your shoulders to my resistance. And come all the way down. Go ahead and give yourself a nice shoulder roll here. Nice range of motion check. Then we'll come down to the neck. We're going to palpate the thyroid gland from the posterior approach, coming from behind. I'm going to have the patient put her head up. I'm going to feel and palpate the thyroid, and then I'm going to have the patient take a swallow. So go ahead and swallow. Good. And you should feel it slide up and slide down in between your fingers would be normal. No lumps or bumps that are extra that I noted there. And now we're going to come down to the thorax and lungs. We're going to inspect the posterior chest. So we're not undressing here today, so we're going to pretend that she's in a Johnny. I'm going to look at her thoracic cage, and I'm going to palpate for lumps, masses, open areas on her skin, symmetry of her chest. Take a deep breath in, and I'm going to visualize that her chest is inhaling and exhaling. And go ahead, take another deep breath in. Good. Inhaling and exhaling. And all of her musculature looks symmetrical to me from behind. And then I'm going to come down and I'm going to confirm symmetrical, right? And where we're going to percuss for CVA tenderness. So tenderness over the field. We're going to take our hands and we're going to palpate and check for tenderness. One hand's at 3 fingers with a fist. Any tenderness there, Barb? No. One hand, 2 fingers, 3 fingers, and a little pound there. And no tenderness, no swelling, and no history of trauma, Barbara? No. Okay. So now we're going to go down to auscultate the breath zones, upper and lower lobes, posterior. I'm going to have the patient inhale and exhale slowly, listening. Go ahead and take a deep breath in on the right. Good. Again. And a deep breath on the left. And now with a middle lobe, deep breath. Nice, exhale. One more time, inhale. Exhale. I don't hear any crackles, wheezes. Okay, now we're on the left lower lobe. Inhale. Exhale. One more. Inhale and exhale. Good job. And one more time, inhale. Good, exhale. Lungs are clear. I don't hear any crackles, rales, rhonchi, or wheezes. I will come down to auscultate cardiac base, has the patient lean forward and exhale, and I'm going to listen for a murmur, although I will say I've never heard one. Inhale, sit forward, take a deep breath in, exhale completely, and I hear no murmur. Sit up. Thank you. Upper extremities, I'm going to inspect the hands and the nails. Skins, look at her hands, see how they look. Skin is intact, normal size. Any history of trauma to your hand? No. Or and turn your hands up? No history of eczema or dermatitis? No. From washing your hands at work so much? No. Spread your fingers, anything between your fingertips? No. Warts, rashes? No. And normally your skin, do you have sensitive skin, Barb? A little bit, but no rashes anywhere? No open areas on your skin? Good. Now we'll come down to color is normal. Palpate joints and wrists and hands. All right, so I'm going to take a look at her wrists and hands now. I'm going to pull her sleeves up. Any history of injury to your hands or your wrists? No. Do you have range of motion in your wrists? Good. Can you bring your hands together and do this? Good. Okay, and do that. Okay, so no pain or anything, tenderness there. Okay, so hands all the way back and all the way forward and on the front. And again, fingertips, spread your fingers. Curl them like this? Good. So no history of any injuries with your hands? No. Okay. You can go ahead and rest them on your lap. Now I want you to touch each finger to each thumb. 1, 2, 3, 4, 5. Good. And all the way back. All right. And now we're going to have you lie down, Barbara, and we're going to fix this so you are going to get your JVD checked. So if you want to lie down with the head of the bed at 30 to 45 degrees. Camera. Yes, we're going to follow you with the camera, and Barbara's going to help me because she's way better at this than I am. All right, so I'm thinking, yeah, there you are. Okay, so at 30 to 45 degrees, I'm going to assess for JVD, jugular vein distension, and I'm going to see if I can differentiate between the JVD and have the patient head turn to all the way to the right. And I'm going to see if I can see that visible pulsation, and I don't know if the camera can see it, but I actually can see it. And you can turn your head all the way to the left, and you might not be able to see this, Wendy, but on this side I can definitely see the palpation. I wish I could figure out how to show it to you. So now that's the carotid jugular vein, and I have to be able to distinguish the two. And the carotid pulsations I can feel. Raise the head of the bed if jugular pulsation is noted, angle pulsation stops. Okay, so if you want to slowly sit up, which we would do, the JVD pulsation would stop. Okay, so now I'm going to have you sit back up and palpate pulsations in anterior chest. Note any abnormal thrill. Oh, this is where I'll keep you lying down, I guess. And this is where I will assess your heart sounds. And I'm going to first auscultate the apical pulse for at least 15 seconds. But what we were taught was 1 full minute, right, Barb?
Correct.
We're the old school girls. There we are again. Wondering if you lost visualization, it's because this computer is horrible, and once in a while I lose the visualization. But I know you heard everything I said, so anyway, so we're at apical pulse, and we're going to go with 60 seconds because we'll take that extra minute to get the right pulse, right?
Absolutely.
Okay. So it seems regular and normal, and she does have a heart, even though she's an ER nurse. Take a long breath in. Good, and a long breath out. Okay. And now we're going to auscultate with our diaphragm to identify S1, S2 in the following sites. Third left intercostal space. So we're going to count from the top. 1, 2, 3. Then put my diaphragm over there and take a deep breath in. Good, and exhale. And then I'm going to go to the aortic, which is the second intercostal space. 1, 2, a little bit higher. And have her take a deep breath in and exhale. Okay. Then we're going to go to pulmonic, which is the second left intercostal space. So 1, 2, deep breath in. And we'll go down from there. So now tricuspid is the fourth left intercostal space. So if this is 2, this is 4. Deep breath in, deep breath out. And then we'll test the mitral, which is a little bit lower down, fifth left intercostal space. And then we'll repeat everything using the other end of the stethoscope, starting with the third left intercostal space again, looking for abnormal heart sounds. Being the honest person that I am, I don't know that I have the skill yet to hear abnormal heart sounds as well as I should. And now we'll go to the pulmonic, which is the second left intercostal space. Tricuspid again, fourth left intercostal space. And then the mitral again, fifth left intercostal space, mid-clavicular line. Okay, so there we go. Next, ask the patient to lean slightly on your left side and auscultate the bell of the stethoscope to the apex of the heart. So a little bit to your left. Okay, good. Take a deep breath in and a deep breath out. And roll back on your back, and now we're going to come to your abdomen and inspect your abdomen. Any history of pelvic injury?
No.
GI surgeries?
No.
You've got one, any history of nausea, vomiting, diarrhea?
No.
Okay, and no abdominal anything. I'm not going to palpate first, I'm going to auscultate first. So I'm going to auscultate the bowel sounds, starting with the right upper quadrant first. So inhale and exhale. Inhale and exhale. Now, back then, we were told a minute, we used to check a minute to hear a sound. And there you go. There's a sound, so I'm going to move on. And I should have started with the right lower quadrant. So we'll start again. And then we'll move to the right upper quadrant. And in theory, follow that for a minute. I'm sorry. And over to the left upper quadrant, and down to the left lower quadrant. So the stethoscope, I'm going to go ahead and see if I can do my aortic exam. Okay, and everything seems great there. Press the center of your hip, go ahead and apply resistance. So I'm going to put over your hip, I want you to push on resistance. Good, so that's normal resistance, no weakness anywhere.
Yeah.
Okay, your lower extremities, we're going to pretend like you have a Johnny, and I'm going to check for symmetry. Any asymmetry in your all the way down to your knees, nothing looks shortened or externally rotated. Any history of injury or trauma?
I have a little pain in my left knee.
So Barb has some pain in her left knee today, so we're going to pretend when we get to Babinski reflex, and we're going to inspect her knee carefully today. She needs her popliteal, her posterior tibial dorsalis pedis pulses checked, so popliteal. And we come all the way down to posterior tibial, and those are equal. And now dorsalis pedis. And they're all normal, nothing's bounding, but I can palpate all of them. The skin is warm and dry, good CSM. And can you go ahead and separate your toes? Any open areas? Nothing? Good. No open areas on your skin. Any problems with your skin on your feet?
No.
Okay. Spread your toes again. Camera. Oh, yeah. We have to move. There we go. So you can't really see her toes, but they're painted pretty good. So go ahead and spread your toes. Good. And again, the pulses, dorsalis pedis, popliteal, and posterior tibial. Good. Now we're going to do the cerebellar function and have you run your right leg down your left leg. Okay. And go ahead and do the opposite. Left leg over the right leg. And we will have you sit up, and we're going to test your Babinski reflex now, but we're going to skip the left knee because her left knee is sore. Wendy, have a seat. Have a seat, sir. Okay. So we're going to test the Babinski reflex with what I'm using for my hammer, which is over here. And a little hammer reflex, and I'm going to test for this little groove that you pick up right here. And then I'm going to give her a little. We got it first on practice, so let's see if we can do it again. Nope. There you go. So that's normal. We're going to pretend to do it here because she is a little sore today, Wendy. So just a little bit, and then I would have a little upward thing, and that would be a good Babinski. And now we'll move on. So from Babinski, we will go to having sitting up, legs are dangling from your lying position. And now we're going to check your neuro. We're going to test your muscle strength of your knees, have you extend and flex against resistance of your knees. So go ahead and extend. Good. And flex. Hold on. Flex. Good. Pull up. Good. And she's got normal strength of her knee joints. We test the patella reflex, sensation and light on the face and forearms using a tissue. So in theory, we would have a cotton ball. And we would start with the face, and she can feel that. So we start there, and then we move down to the sensation of her forearms. So just pull your sleeve up, in theory. And we've got this, and we come down, and we've got cotton balls, which I don't have.
But I can feel it.
You can feel it all the way down. Good. And now we're going to test rapid alternating hand movements. I'm going to stop this here, Wendy. Actually, I'm not going to stop this. I'm going to move on. I'm going to ask you to walk across the room now. So I'm going to have you stand up, and I'm going to move the camera, and I'm going to have you walk across the room. I'm going to tilt the camera down so you can watch her, and she's
just walking on
her gait, and we're going to assess her gait. And gait is steady. She doesn't lean to the right or lean to the left. And coming back, I'm going to have her start to come back, and now I'm going to have her back up and have her walk back toward me, heel to toe. So heel toe. Good. And she seems to have good balance, and she has good strength. We are going to test for Blomberg signs, so she's going to stand with her feet together. And go ahead and close your eyes, Barbara. Can you see? Perfect. I'm going to come up a little bit there. And close your eyes, and for 20 seconds, I will count. I just want you to close your eyes and stand. But I'm going to come behind you and just protect you, so if you are to lean to the right or the left. So after 20 seconds, we'll stop. It's going to seem like a long 20 seconds, Barb. Okay, so she's not leaned to the right, and she has not leaned to the left. Now I'm going to have her bring her arms out in front of her, and with her palms facing up. And I'm going to have her stand for a bit to see if she has any drops in arm, either down or changes the position. Okay. And go ahead and drop your arms at your sides. So we're going to check the range of motion of her spine. I'm going to have her bend at the waist and come all the way down nice and slow for a nice strengthen. Take a look at her spine, and it seems to be midline, and I don't see any abnormalities in it. I'm going to have her come all the way back up. And now I'll have her bend to the side, so I'm going to have her go side to side. And look at me, I'm demonstrating too. Okay, and now we're finally going to do a knee bend. So you're going to let one knee relax. Doesn't matter which side first. Hold on. And go ahead and come all the way down. Now the left side is sore again, Wendy. And the right side all the way down and up. And now we're going to come to face me. And I'm going to thank Barbara for doing this for me today. And I'm going to thank you, Wendy, because I am totally petrified to do this. So with an open mind, I know you know I'm a good student, so I'm looking for a really great grade. Thank you, and bye. See you.